Dear friends, welcome to this video. I'm going to demonstrate medial meniscus bucket handle tear repair in an ACL reconstruction which has been done 1.5 years before. You can see this ACL which is reconstructed 1.5 years before is appears strong and integrated very well. You can see the threads and ethibond. I'm feeling the ACL using shaver, and now I come to medial compartment. You can see that there is a bucket handle tear of the medial meniscus. Now I reduced it and taking one stitch from the middle of the meniscus. This is called traction stitch. I have taken one stitch from the meniscus, one from the capsule. Now below this is the second stitch. These are inside out needles and adjustable cannula, single lumen cannula I have taken. Now that one superior and one inferior stitch. Now I am looking at, I have changed the portal. I am looking from the medial uh, portal, and I am now going to take spatula and all inside stitch to the most medial part of the tear, where the tear starting part of the tear. Yes, this is first bite, and the second one to the capsule. Yes, now it is complete. This is fiber stitch device. The first stitch to the most medial, just adjacent to the root of the meniscus. I am now tightening this, and I am going to cut this. This is the second one, red white zone, and the tear was in the red white zone, and also there was another tear behind. This stitch is going to take care of both the tears. Yes, now I am taking it out and then going to take the second. I am going to deploy it behind so that it will take the bite. Yes, now this is taking care of bucket handle component, and also there was one more horizontal tear. Yes. Yes, this is now taking nice shape, and it's compressing the tear. Now this is the cutter. So I cut the stitch. Okay. Now you can see there are two inside, all inside, and three inside out needles. This is another stitch from capsule to the meniscus. Yes. And one more stitch I'm going to put now. You can see all these stitches, one to the capsule and one to the red zone of the meniscus, are going to abut this meniscus tissue to the capsule where the tear is there. Yes. Now I have completed four stitches, five stitches inside out and two all inside. This is the sixth one to the anterior part. Yes. Now I am trimming that short radial component tear which was seen in the middle of the bucket handle tear. I am trimming this so that it should not propagate as a continuous tear, radial tear. This is completed repair which I have done about 5 stitches inside out needles and 2 all inside stitches. This completes the repair of the medial meniscus bucket handle tear. Thank you for watching this video. Thank you.